Welcome to the Nov28 HCV online training course developed by the Asian Liver Center at Stanford University. In this course, you may click the pause button and all of your progress will be saved. In addition, you may move between completed sections at any time. To pass this course, you must receive 100% on the final quiz. You will then receive a certificate of completion. Let's begin. The Nov28 HCV online training course consists of the following modules. Module 1. Burden of liver cancer and chronic viral hepatitis in the world and in Vietnam. Module 2. Types of viral hepatitis and their transmission routes, hepatitis B facts, diagnosis, and immunization. Module 3. How to prevent the transmission of bloodborne infections and injection safety. Module 4. Long-term monitoring and treatment of chronic hepatitis B. Module 5. Prevention, diagnosis, and treatment of chronic hepatitis C. At the end of each module, you must pass a quiz before moving on. Now, let us begin with Module 2. Welcome to Module 2, Types of Viral Hepatitis and Their Transmission Routes, Hepatitis B Facts, Prevention, and Diagnosis. In this module, we will cover the following topics. How are the different types of viral hepatitis transmitted, the prevalence and facts about the hepatitis B virus, HBV, diagnosis and outcome of HBV infection, and hepatitis B immunization to prevent HBV transmission. Viral hepatitis is categorized into A, B, C, D, and E. Each type is distinctive and has different transmission routes. Hepatitis A and E are transmitted through consumption of food and water contaminated by feces. Although hepatitis A and E can lead to serious liver damage and even death, they do not cause chronic infection, liver cirrhosis, or liver cancer. Hepatitis B and C can be transmitted through blood and unprotected sex. In the endemic countries in Asia, mother-to-child transmission is the most common cause of chronic hepatitis B infection. The most common transmission route for hepatitis C is through blood, such as from using or sharing needles and syringes. Both hepatitis B and C infection can become chronic and may cause cirrhosis and liver cancer. There are safe and effective vaccines to prevent hepatitis A and B, but there is no vaccine available to prevent hepatitis C. There is a new hepatitis E vaccine from China, but currently it is not recommended for routine use. Hepatitis D is mainly transmitted by blood and unprotected sex. Note that hepatitis D infection can only occur in patients who are already infected with hepatitis B. Hepatitis D infection can become chronic and cause cirrhosis and liver cancer. Preventing hepatitis B infection by vaccination will protect you from hepatitis D infection. Let's examine the facts about hepatitis B virus infection. About 240 million people, or 3.2% of the population in the world, have chronic or lifelong hepatitis B infection. This is about 7 times more than the 35 million people living with HIV/AIDS in the world. In Vietnam, hepatitis B takes over 15,000 lives a year and is the cause of about 40% of liver cancer deaths in 2013. Hepatitis B infection is caused by the hepatitis B virus HBV. HBV consists of an outer lipoprotein envelope containing the hepatitis B surface antigen and an inner core which contains a partially double-stranded DNA and DNA polymerase surrounded by the hepatitis B core antigen, HBcAg. With a diameter of 42 nanometers, it is one of the smallest envelope viruses and is invisible to the naked eye. So, how is the hepatitis B virus transmitted? HBV has 3 main transmission routes: birth from an infected mother to a newborn, blood, and unprotected sex. HBV can be transmitted from a chronically infected mother to her child during the birthing process. Mother-to-child transmission at birth is the most common cause of chronic hepatitis B infection in the highly endemic Asian countries. Without proper immunoprophylaxis, infants exposed to hepatitis B virus at birth have up to a 90% chance of developing chronic infection. Note that chronic hepatitis B is not a hereditary disease. Hepatitis B can be transmitted through direct contact with infected blood, such as wound-to-wound contact, sharing needles for tattoos, piercings, acupuncture, or injecting drugs, sharing contaminated razors or toothbrushes, When using syringes or medical devices, including glucose monitoring devices for diabetic patients, transfusion of infected blood or blood products, or use of unsterilized dental equipment. The third transmission route is through unprotected sex with an infected person. The use of condoms can reduce but not eliminate the risk of infection. Vaccination is the best way to protect yourself. In 1988, Shanghai, a large city in China, experienced a hepatitis epidemic that sickened 300,000 people, with many people hospitalized and some fatalities. Can hepatitis B be spread through food? The answer is no. Hepatitis B is not transmitted by food or water. The outbreak of hepatitis in Shanghai was caused by hepatitis A through the ingestion of contaminated raw clams. Hepatitis B is not transmitted by sharing food or drinks. It is not transmitted by casual contact such as working together. It is not transmitted by shaking hands. It is not transmitted by coughing or sneezing, and it is not transmitted by hugging or kissing. Confusion about the transmission routes of hepatitis B is a major cause of discrimination against those infected by hepatitis B. Now let's learn about what happens when a person without immunity becomes infected with the hepatitis B virus. The outcome of HBV infection is closely related to the person's age. This chart shows that the younger the person becomes infected, such as newborns, the higher the chance they will not clear the infection and will develop lifelong chronic hepatitis B infection. If infected at birth through mother-to-child transmission, as many as 90% may develop chronic hepatitis B infection. If infected between 1 to 5 years old, 30 to 60% may become chronically infected. If infected at an older age, only 5 to 10% may become chronically infected. This chart also shows that the younger the person who becomes infected, the less likely they will have any symptoms associated with the infection. On the other hand, up to a third of older children and adults who become infected will develop symptoms of acute hepatitis that include jaundice, fatigue, and loss of appetite. As many as 90% of newborns to hepatitis B infected mothers could develop chronic infection if they were not vaccinated at birth. Since most of them did not develop symptoms, without a blood test for hepatitis B, many would not know they have been infected. In Vietnam, most of the people with chronic hepatitis B were infected at birth or early childhood because they are not vaccinated. In adults, about a third of those infected will become sick with symptoms including jaundice, fatigue, nausea, abdominal pain, and loss of appetite. 0.5 to 1% could die from fulminant liver failure within a few months of infection. Most adults will recover and develop immunity, but 5 to 10% could develop chronic hepatitis B infection. Therefore, unprotected adults are also encouraged to get vaccinated to protect them from future infection. People living with chronic hepatitis B infection are often asymptomatic and often called hepatitis B carriers, but they are still infectious and can spread the infection to others through mother-to-child transmission at birth, blood, and unprotected sex. Even though they might feel healthy, without proper long-term monitoring and treatment, chronic hepatitis B can progress to cirrhosis or liver cancer. If left unmonitored and untreated, chronic hepatitis B carries a 15 to 25% risk of death from liver disease or liver cancer. Now, let's turn to diagnosis of acute and chronic hepatitis B infection. This chart shows a serological response after the initial acute infection. After the initial infection, blood tests for hepatitis B surface antigen, HBsAg, becomes detectable within 4 weeks. If the person clears the infection and develops immunity, the surface antigen will no longer be detectable after 24 weeks or 6 months, and hepatitis B surface antibody, anti-HBs, will become detectable around 32 weeks. If the person fails to clear the infection and develops chronic hepatitis B infection, HBsAg will remain positive after 6 months. Diagnosis of acute hepatitis B infection is made by a blood test for IgM hepatitis B core antibody, IgM anti-HBc, which becomes positive 6 weeks after the initial infection, but will become undetectable after 32 weeks. Any person who has previously been infected with hepatitis B will test positive for total hepatitis B core antibody, total anti-HBc, but the positive test alone does not determine whether the person has developed immunity or chronic infection. To determine whether a person has chronic hepatitis B or immunity to hepatitis B, the following two blood tests are recommended: hepatitis B surface antigen, HBsAg, and hepatitis B surface antibody, anti-HBs. This table shows the interpretation of the test results. If HBsAg is positive and anti-HBs is negative, then the person is currently infected with HBV. If the test result remains positive after 6 months, or IgM anti-HBc is negative, it confirms that the person has chronic hepatitis B. If HBsAg is negative and anti-HBs is positive, then the person does not have chronic hepatitis B and is immune to HBV due to either recovery from prior infection or prior vaccination. If both HBsAg and anti-HBs are negative, then the person does not have chronic hepatitis B and is not immune. This person will benefit from vaccination. If both HBsAg and anti-HBs are positive, and HBsAg remains positive after 6 months, then the person has chronic hepatitis B. In this case, the positive anti-HBs result does not represent protection against hepatitis B. HBsAg is a standard test to diagnose chronic hepatitis B infection.
My brother has been diagnosed with chronic hepatitis B. He suggested that I should get tested, but I feel perfectly healthy. Do I really need to be tested?
Your brother is right. Most people with chronic hepatitis B infection have no symptoms. Many were infected from mother-to-child transmission and child-to-child transmission in early childhood. You, like your brother, could also have become infected. That is why if one member of the family has chronic hepatitis B, the remaining family members should also get tested to see whether they are also infected or need to be vaccinated. After Tuan went to get tested, he asked his doctor what the results mean. Your blood test showed your hepatitis B surface antigen, HBsAg, and hepatitis B surface antibody, anti-HBs, are both negative. The negative HBsAg means you do not have chronic hepatitis B infection, and your negative anti-HBs means you do not have immunity to hepatitis B. I recommend that you get vaccinated to protect you from becoming infected. The negative hepatitis B core total antibody means you have never been infected with hepatitis B.
Thank you. I will go to get my hepatitis B vaccination right away.
Now let's discuss what is the best way to prevent hepatitis B. Based on the transmission routes of the hepatitis B virus, general preventive measures include avoiding direct contact with blood and bodily fluids, do not reuse or share needles and syringes, avoiding unsafe transfusion of blood and blood products, and avoiding unprotected sex. The single most effective measure to prevent hepatitis B is immunization. A highly effective and safe hepatitis B vaccine has been available since 1982 and is the best way to protect everyone from becoming infected with hepatitis B. The hepatitis B vaccine is also known as the first anti-cancer vaccine because hepatitis B is among the most common causes of liver cancer worldwide. Following the WHO recommendation, many countries have incorporated the hepatitis B vaccine into their national immunization programs for infants who are most susceptible to developing chronic hepatitis B infection. Through newborn hepatitis B vaccination program, mother-to-child transmission has been dramatically reduced in many countries. Millions of children have been saved from becoming chronically infected, which would have put them at risk for developing liver cancer and cirrhosis later in life. As a result of the gradual introduction of hepatitis B infant immunization program in Vietnam in the 1990s, prevalence of chronic hepatitis B in children 3 to 4 years old has dropped to 1.6% in 2011, compared with the rate as high as 18% in a study in children 4 to 5 years old in 1998. Prevalence of chronic hepatitis B was 1.5% in infants who received the first dose of the hepatitis B vaccine within the first 24 hours of birth, compared with 2.8% in infants who received the first dose between 2 to 7 days and 3.2% in infants who received the first dose after 7 days. Therefore, a timely birth dose within 24 hours is important to protect the newborn from becoming infected. All newborns to HBsAg negative mothers should receive a dose of the hepatitis B monovalent vaccine within 24 hours of birth when the baby is stable after routine newborn care, including checking for breathing, cord cutting, and breastfeeding. Low birth weight is not a contraindication to vaccination as long as the baby is stable, although the expanded immunization program in Vietnam recommends delaying hepatitis B vaccination in babies that are born to HBsAg negative mothers until they weigh 2 kilograms. After the first shot, the baby should then complete the hepatitis B vaccination series with the pentavalent vaccine given at ages 2 months, 3 months, and 4 months in order to obtain long-term immunity. There is no need to perform hepatitis B blood tests after vaccination in babies born to HBsAg negative mothers. For newborns of HBsAg positive mothers, to prevent mother-to-child transmission of hepatitis B, the expanded immunization program in Vietnam recommends that the baby receives a dose of hepatitis B monovalent vaccine and, if available, a dose of hepatitis B immune globulin (HBIG) within 12 hours of birth when the baby is stable and after routine newborn care, including checking for breathing, cord cutting, and breastfeeding, even in low birth weight babies. Newborns must complete the vaccination series with the pentavalent vaccine at ages 2 months, 3 months, and 4 months. This is over 95% effective in preventing the newborn from becoming infected. For newborns of HBsAg positive mothers, post-vaccination blood tests for hepatitis B surface antigen and hepatitis B surface antibody is recommended at 1 to 2 months after completing the vaccine series. This test indicates if the baby is protected. If the post-vaccination blood test shows that the baby remains unprotected, both HBsAg and anti-HBs are negative, then the baby should receive an additional 3-shot hepatitis B vaccine series with the monovalent vaccine and get retested to check whether the anti-HBs turns positive. Besides newborns and unvaccinated young children, healthcare workers are at an increased risk of becoming infected due to occupational exposure to blood, bodily fluids, and tissues from hepatitis B infected patients, and they are among the priority groups for hepatitis B vaccination. Household members of infected individuals are also among the high priority groups for vaccination. Other groups who are at an increased risk of infection and should be offered hepatitis B vaccination include injecting drug users, men who have sex with men, individuals with multiple sexual partners including sex workers, HIV/AIDS patients or those with other sexually transmitted diseases, patients with end-stage renal disease or on dialysis, patients with chronic liver disease including hepatitis C. Any person who wishes to be protected from hepatitis B should also be offered vaccination. If you are already infected with hepatitis B virus, vaccination does not provide protection or treatment. Hepatitis B vaccine is safe and effective. It has been in use for more than 30 years. There are minimal reactions such as pain at the injection site or transient fever. Serious adverse events blamed on hepatitis B vaccine are largely unfounded. For instance, 3 infant deaths blamed on hepatitis B vaccine in Huang Ha district of Quang Tri province in 2013 was due to a nurse who mistakenly gave the infants an adult medication stored in the same refrigerator. This unfortunate medical error resulted in the death of all 3 infants. It also emphasizes the importance of storing vaccines in a location separate from other injectable medications to prevent medical errors. So far, we emphasize the importance of getting vaccinated against hepatitis B, but it is equally important to store and administer the hepatitis B vaccine correctly. The hepatitis B vaccine should be stored in a refrigerator at 2 to 8 degrees Celsius and separate from other medications. Check the vaccine vial monitor (VVM) on the vaccine vial to make sure it has not been damaged by freezing or heat. Before you load the syringe, make sure you shake the vaccine vial. If the vaccine layers do not mix, it should be discarded. In certain circumstances, such as in efforts to improve hepatitis B birth dose coverage in remote rural areas, control temperature chain, or out of cold chain delivery of the hepatitis B vaccine at room temperature up to 1 month has been shown to be safe and effective. The vaccine should be administered intramuscularly in order to be effective. In infants and young children, the preferred injection site is between the upper and middle thirds of the lateral thigh muscle. In adults and older children, the shoulder deltoid muscle is the preferred injection site. The vaccine is less effective if administered subcutaneously in fatty tissue. For newborns of uninfected mothers and low-risk adults, most will develop long-term protection and immunity after immunization. They do not need to be tested for hepatitis B surface antibody. Routine booster hepatitis B vaccination is not recommended by the WHO. For newborns of infected mothers and high-risk adults, for example, healthcare workers, sexual partners of HBsAg positive persons, and hemodialysis patients, a blood test for hepatitis B surface antibody, anti-HBs, should be performed 1 to 2 months after completion of the hepatitis B vaccine series to ensure that they have developed protective levels of immunity. Hepatitis B surface antibody levels greater than or equal to 10 milli-international units per milliliter is considered as protective. For high-risk individuals who did not develop protective levels of antibody after the first 3-shot vaccine series, they should be offered a second 3-shot vaccine series, preferably from a different manufacturer, and get retested. Those who fail to develop immunity after 2 complete vaccine series are considered as vaccine non-responders and no additional vaccine is recommended. All pregnant women should be tested for HBsAg at an early prenatal visit to see whether they have chronic hepatitis B, which puts the newborn at greater risk of becoming infected.
I have chronic hepatitis B infection and I'm pregnant. How do I protect my baby from becoming infected?
It is very important that your baby receives a dose of hepatitis B monovalent vaccine and, if available, a dose of hepatitis B immune globulin (HBIg) within 12 hours of birth when the baby is stable and after routine newborn care, including checking for breathing, cord cutting, and breastfeeding. Newborns must complete the vaccination series with the pentavalent vaccine at ages 2 months, 3 months, and 4 months. This is over 95% effective in preventing your baby from becoming infected. Also make sure the baby receives a blood test 1 to 2 months after completing the vaccine series for hepatitis B surface antigen and hepatitis B surface antibody to make sure your baby is protected. If the blood test showed the baby remains unprotected, then the baby should receive another hepatitis B vaccine series and get retested.
Great! I will make sure my baby receives the first dose of the hepatitis B vaccine and the hepatitis B immune globulin within the first 12 hours of birth. After delivery, can I breastfeed my baby?
If your baby received the first dose of the hepatitis B vaccine and a dose of the hepatitis B immune globulin within 12 hours of birth, it is safe for you to breastfeed.
What should I be aware of during my pregnancy?
Make sure your doctor checks your blood test for liver enzymes during your pregnancy to monitor for the development of active hepatitis that may require oral antiviral treatment. A one-time blood test for hepatitis B e antigen (HBeAg) and hepatitis B DNA level is also recommended. Both tests would help your doctor determine whether you have an increased risk of transmitting the virus to your baby and whether the use of oral antiviral medication is recommended during the last 3 months of your pregnancy to further reduce that risk. A positive HBeAg test means that the person has a large amount of hepatitis B virus, and the actual amount can be determined by measuring the hepatitis B DNA level. You should make sure that your husband, parents, brothers, and sisters get screened for hepatitis B. Those who are unprotected should get vaccinated.
Thank you. I'm glad my baby will be protected from hepatitis B, and I will make sure all my family members get tested for hepatitis B.
Now, let's review what we have learned through the following quiz questions.